Another possible method of investigation for hypertrophic cardiomyopathies, that's like you're trying to confirm if a patient has what? A hypertrophic cardiomyopathy. That means what? Their heart is enlarged. We are talking about this hypertrophic cardiomyopathy. Alright. So in this one now, the heart muscles are enlarged itself. Unlike the dilated cardiomyopathy where the heart muscles have the same size, but is the heart cavity that is becoming big. Okay, in hypertrophic is the heart muscles. So if you want to confirm that somebody has what an enlarged heart muscles, one of the methods you could use is what ECG, which is what electrocardiography, or some people call it what electrocardiogram. Okay, so we'll get to see how this process actually work. And if you are doing an ECG, what are the things you are trying to like look out for? Okay, so ECG is what applicable in 95% of cases. All right. So below are the features of ECG. Like if you're doing an ECG for a patient that has what? An enlarged heart muscles, there are some things you check out for. The ST segment and the T wave will be abnormal. Okay. So if you come here, I have the picture. You see that what? This is when the ST segment is elevated. Can you say it's elevated? This is ST depression. All right. There's no indication for T wave, but at least everybody watching this video should have known what a T wave is, right? So T wave too will be abnormal. Okay. Then okay. So if you have all that, it indicates that there's a left ventricular hypertrophy. Okay. Then pathological Q waves can be seen in inferior and lateral leads, and it shows that there's a septal hypertrophy, right? If there's a deep T wave inversion, that's particularly in anterior and inferior leads in the apical form of what? Hypertrophic cardiomyopathy. Okay, so another thing is if there's a pre-excitation and Wolff Parkinson syndrome can also be dictated by this. Arrhythmias can also be picked up by ECGs. Arrhythmias will even be quite simple. Just simply see an irregular ECG running up. So echocardiography continues to remain the gold standard investigation due to its widespread availability. Right? The investigation is usually for dictation of the presence, magnitude, and distribution of what? Left ventricular hypertrophy, as well as you want to also identify patients with a basal left ventricular obstruction. Okay, so in as much as what ECG can be used, echocardiography still remains like what? The top. Okay, so asymmetrical septal hypertrophy can also be dictated by this. We see that there will be a grossly thickened septum compared with the posterior left ventricle wall, okay, with reduced aseptal motion. Right. However, almost any pattern of left ventricular hypertrophy is possible. Right. You can also use ECG to dictate if there's a small left ventricle cavity. You can use it to dictate what? Systolic anterior movement of the mitral valve apparatus. You can also use it to dictate for mid-systolic valve closure or fluttering of the aortic valve. If there's a leaflet tips, or if there's an impaired diastolic function and left atrial enlargement. Okay, so diastolic is more of like the heart relaxation to get filled up. So if there's a dysfunction with the heart being filled up, you can also use the ECG to actually pick up those things. Okay, so this is the application of what? Electrocardiography in investigating what? Hypertrophic cardiomyopathies. Basically any disease condition that is causing the heart muscles to become thick. All right, and everything we spoke about are the things that are applicable to this concept.